Hello and welcome to A Dose of Wellbeing, the Pharmacist Support Podcast. I'm your host, Melissa Cochran, Wellbeing and Development Manager at Pharmacist Support, the profession's independent charity. We're delighted to bring you inspiring stories, tips, and expert insights that can help enhance your well-being and make a positive impact in your professional life. This podcast is all about supporting you, our pharmacy family, as you navigate the challenges of the profession. Today we're speaking with Jazz McPhail, a pharmacist and nutritional therapist with her own practice, the Nutrition and Lifestyle Pharmacist. Recognizing that there was sometimes a gap in conventional medicine and its focus on individual symptom management with a lack of understanding and exploration of root causes of illness and disease states, Jazz wanted to increase her knowledge in order to better support patient health. In a time when most of us have heard of the concept of food as medicine, Jazz takes her unique knowledge of medicines and food and nutrition to help people to create lasting change in their lives. We hope you enjoy today's conversation. So welcome to the podcast, Jazz.
Thank you. Thank you for having me today.
It's great to have you here. And I'm interested to hear what brought you to decide to train as a nutritional therapist. Was there something that happened in your life? Was there some research that brought you to it? Can you just sort of take us through how you got to where you are now?
Yeah, sure. I think there was quite a few pivotal moments in my life, I think, that brought me where I'm at. I think there's always been a healer in me. I think if some people want to look at it from a spiritual perspective, I've always been somebody who's like, and looking at what is the root cause of things. So when I was younger, obviously I grew up in an Indian family, in a Punjabi family, and if we got unwell, even if we just went to India, for example, the first port of call would be for my mum or my relatives to go, right, if you've got an upset stomach, here, have these seeds, mix them with a bit of water and have that. And sometimes they didn't taste very nice. Obviously things like mint we used to use that quite a lot, and things like ginger as well, if you felt sick or just had a bit of a tummy upset. I was exposed to using food as medicine at the time, and in particular things like herbs, really. And it sort of made me sort of think, oh, this is really interesting, that this stuff actually works. I mean, another example is I used to get quite a recurrent cough, and my mum used to make this tea, and it used to grind down different things in it. I'd read the package and I was like, oh, there's licorice in it, some bark of something, and just mixed it up and made a tea out of it. And again, it didn't taste amazing, but it did work. And I was like, this is really fascinating. And obviously growing up around friends and family who had different health conditions, they were on medication, and I used to think, how on earth does this medicine know whereabouts in the body to work? And it got me thinking the same about food and herbs as well. I just thought it was pretty amazing. And obviously with Indian culture, we do learn quite a lot about Ayurvedic medicine, and I think that's something that they use quite a lot still in India. And those are the sorts of things. And I was very interested in science. I just was very fascinated about how the body worked, what was going on in the universe. So I think these two passions sort of led me to wanting to pursue a career in health, and trying to help the body, support the body in its healing process, in terms of having optimal health as well. I think initially I was thinking about, I think my first protocol was I want to do medical herbalism. And I remember talking to my dad about it, and he was like, at the time, I think it wasn't very well known. Maybe there were pockets of people doing that sort of thing. And he was like, why don't you do something a bit more mainstream? You're interested in things like how medicines work. And obviously some medicines come from herbs, like aspirin from the willow bark. You've got digoxin from the foxglove plant. And I was like, actually, yeah, there are ways that medicine can help as well. So I ended up studying pharmacy at the time, and my dad did say you can always branch off another time, in the future. Yeah. So that's how I got into doing pharmacy. And then during my pharmacy career, I did enjoy it in the younger, the years where we're training and you're sort of soaking things up like a sponge. It was fascinating. Obviously, I learned about how things worked on a receptor level, and specifically how it worked in the body, but also learning about how we worked in Boots on a Saturday or something about which medicines you couldn't give with other medicines. So I was like, oh, that's interesting that there's an interaction issue going on. I wonder why that is. So again, learning all about that was really fascinating. So yeah, and then during my sort of early 30s, I was in a very busy hospital pharmacy job. My dad had passed away quite suddenly, and I think I didn't realise how stressed I was. I was sort of running on empty a little bit and running around all the time, just rushing from one job to another. And I think the bereavement sort of stopped me in my tracks a little bit, and then my body sort of was reacting to some of the stress and the bereavement as well, and just felt, that there was something going on in my body that I needed to, it was trying to get my attention in terms of the effects of stress and feeling anxiety as well, noticing that at specific times of my cycle, my monthly cycle, for example, as well. So I just started to research things because I was very drained of energy as well. I was just very tired. And I thought initially it was a response to the bereavement. And then, I was getting some symptoms that I thought, actually, I'll go to the doctor about it. Cycles out of whack. I was getting a constant cough at that time as well. And little did I know, in Chinese medicine, they say you hold grief in your lungs, actually. And I was experiencing that. But you go to the doctor and the doctor was, the couple of things I can give you. Obviously, you've got low mood, you've had this bereavement, there's a lot going on, and you're in quite a fast-paced job. And, to help you keep going, we can either offer you the oral contraceptive pill, because it could be to do with your cycle and with the anxiety, or we can give you an antidepressant. And I remember thinking, I don't want either of those. Like, I think there is more to this than meets the eye. So I just went off and did quite a lot of research and was on like different webinars, listening to podcasts and things, and then just was on a journey of finding out how I can support my adrenals better, and the fatigue that I was experiencing, to sort of nourish my way back into health. Things like reducing your caffeine. Not that I was drinking a lot at the time, but I did notice that was making things worse with my anxiety. And then doing a bit of research on why at certain times of your cycle you might be experiencing more anxiety, and it's hormonal imbalances. So I did do some functional testing of my own. So I did like a food intolerance test. At the time, it came back with things like cow's milk. And I remember thinking naively at the time, I think you sort of think about food intolerance and things like dairy, you sort of think, well, I've not got an upset stomach. Normally people say they've got really bad cramps, or they go into the toilet quite a lot. Yeah. I've got loose stools. I was like, I'm not having any of that. So is it really a sort of a dairy intolerance? But little did I know, as I sort of did more research, and obviously in my nutrition training now, that actually it was protein casein in it that was probably causing that issue with the anxiety. So yeah, that's where my desire to study nutrition, learn more about it, I was like, this is fascinating. Why aren't we talking about this in the NHS? But I think the timing wasn't quite right at that time in my life generally, because life was quite busy. I was working weekends, I was doing on call. I was, when you're on your own, I was single, you're sort of holding the fort yourself. But then sort of years later, obviously during COVID, I think a lot of people can vouch for, there was a bit of a reset within us all. And obviously COVID itself sort of raised the profile of health, and made us sort of think, how can we sort of support our immune systems better? There's so much more that can be done. So I think that's when I started to, with all the NHS pressures, for example, as well, I started thinking, actually, in my role, I'm feeling more and more removed from that patient contact, because it's such a busy environment. Yeah. I want to help people get to the root causes. And I was just seeing patients coming back in, like reattending as well through A&E or whatever it was. And I just felt like all we were doing was just giving them more medicines. But then I've seen a lot more deficiencies, whether it was magnesium or vitamin D. And I was like, there's some things brewing under here that we could so much help people more and more with. Yeah, so that was the sort of reasons, yeah.
That's really fascinating. And I can see sort of that progression through your life of how you were thinking about it and how it came to a point where you felt you needed to make a change. And for people who don't know, can you explain to us what nutritional therapy is and what a nutritional therapist does?
Yeah. So nutritional therapy, it is about using food to support the body in its healing process, but also to, for optimal health. So I think it's not just about sort of whether you've got an issue or a symptom, we need to sort of address that. That is definitely, there is place for that. But it's also sort of giving your body the nutrients that it needs for optimal health moving forward, whether it's healthy aging, being strong, for sports nutrition, for example. And so many specific areas that you can work with. But it's also about using diets as needed, like therapeutic diets. So it may be that there are some intolerances in people, like the FODMAP diet, or there are like the ketogenic, like people do use that for people who've got things like epilepsy or certain conditions, especially for brain health. So it's using, therapeutic diets, but it's also about maybe fasting, thinking about fasting and allowing or having those pockets of time where your gastrointestinal tract's having a break to be able to just clean itself and do the repair that it needs to do instead of us constantly eating. And then it's using, all of this is obviously evidence-based science. You're looking at what the latest studies are showing, what the research is pointing towards, which is constantly changing. There's so much more coming out, actually. It's very interesting in a changing landscape. But it's also about obviously using supplements where needed, but functional testing to help get to the root causes and sort of highlight what's going on a bit more as well. So as a nutritional therapist, what typically what I would do is it is more of a holistic approach. So it's looking at the body as a whole. So somebody may come with, for example, gastrointestinal symptoms, but we would also then look at how the nervous system is sort of affecting that, or vice versa. They are very intricately linked. I mean, as you know yourself, they've got brain axes and loads going on the microbiome, for example. So when we do like a health sort of intake questionnaire or consultation with somebody, it would be looking at what's going on from birth till the present day and what's been happening in terms of what the antecedents are, what's happened when they were at a younger age that could have led to where they are now. So it could have been high antibiotic use, for example, that's then changed the landscape of their microbiome. And then you've got things like what triggers have happened in life. It's quite interesting when you do a timeline, you're like, oh, that might have triggered it. Or it could be about a food poisoning that they had when they were in Thailand, for example. And then ever since then, you sometimes hear people say, I've not been the same since this point. Something changed. And then you've got mediators. So what things are mediating these symptoms? Is it ongoing stress? Is it poor diet? Are there nutritional deficiencies, or is there an intolerance that's driving that, for example? But it's so fascinating. That's where the research can come in, because you can look at a condition and go, oh, I would have linked that to this condition, and actually what does the research say about what we can do about it? So and then you would do things like food diaries, obviously look at what's going on a general picture, where there may be pockets of deficiencies, what's missing, what they're having too much of. Is it too much of processed foods or too many trans fats, for example? Are they missing any minerals and vitamins that they should be having? Because I think a lot of people think, a nutritional therapist will tell me I can't have this, and this. But actually, sometimes it's also about, actually, you need to put more of this in or this in. So it's just as much about putting things in as taking out. But everyone's so individual. I think that's the beauty of the process. Is like, it's not like one size fits all. It depends on your genetic profile, your how your body is. I mean, obviously going back to the Ayurvedic medicine and Chinese medicine, they very much look at like the constitution of a person. So like, I remember my mum saying, don't have this food when you've got a cold, because it's a damp food and it's going to make your cold worse. And I used to think, what's she talking about? And then don't have too many warming foods if you're on your monthly period or something, because it just causes more circulation and it can make things a little bit worse, or, so it was quite an interesting concept. And then doing the course I did, which was from a naturopathic perspective, was really a sort of lit up, because it sort of brought that back into the sort of landscape for me again, about, the Ayurvedic side and the Chinese medicine side, as well as what science says as well. So it's like loads of wisdom from all the years, but putting it alongside some science as well. So
that's fantastic. And I'm sure there'll be a lot of people really interested to hear that, who maybe don't know what nutritional therapy is, and that it can address so many issues. So do you see your work as a nutritional therapist? How do you see it as similar or different to what you do or did as a pharmacist? There are some similarity. I was just reflecting on how, so as a nutritional therapist,
I'm using quite a lot of the skills that I did gain as a pharmacist as well. And that's in your history taking, for example, you know, sort of getting to, like, you have to sort of be a bit of a detective and a bit of an investigative sort of perspective. And then things like, you know, asking, for example, in pharmacy, we would ask patients, you know, what medicines are you on, but also trying to look at the bigger picture and go, what over-the-counter medicines are you on, what supplements are you taking, and sort of building a picture to see what could be going on, you know, in terms of their blood test results. Are there any interactions going on? So looking at that, and I still use those skills even as a nutritional therapist, because you do have patients coming to you who may be on a list of medicines, and you've just got to be mindful before you know, advise any supplements or even some herbs, for example. You just need to be mindful of any interactions. But it's having that conversation, you know, with patients, and speaking to them in layman's terms, you know, like making it more clearer as to what healthcare is about, what we're trying to achieve. So having that and getting them on board with it, and not just sort of, I think for me, I'm a massive advocate, and I think not everyone thinks this way. Some people, even in the nutritional therapist world, might say people don't really need to know the why. Just tell them this is. Some people just want to know, just tell me what to do, give me a meal plan, and that's it. Yeah. And that might be true of some people, actually. Some people just are very much more, I just need to, my life's so busy, I just need to be told what to do. But I'm a massive advocate for empowering people with the knowledge and the understanding as to why I'm asking them to do a certain thing, why we are taking something out, or why we are putting something in, why I'm advising a supplement. Because I feel like if they don't know the why, they could sort of go off and be like, well, I'm not sure that's made a difference, or I'm not sure why I've been told this. I mean, it was the same with medicines. Like, I would tell people, you know, try to avoid taking this with food. And the reason for this is it will increase the absorption and your antibiotics will work better and quicker, for example, or take this metronidazole with alcohol, because you might end up with a rash, and it can be quite severe in some cases. You know, it's that sort of, I think it's important, I think, to empower them with that information.
I totally agree. In my practice, I've seen that as well, that when people understand why, I think that they're much more likely to follow through than just having a set of advice. Yeah, that's great. And how have other pharmacists sort of responded to you moving in the direction of nutritional therapy? Have you had any feedback from people and what they think?
Yeah, it's a good question. I think some people are sort of indifferent to it. They go, oh, well, that's quite nice, you're doing something different. Some of it can cause a little bit of confusion, because people, when they think pharmacist and nutrition, they typically think of a nutritional pharmacist who is specialising in TPN, which is total parenteral nutrition, which is like IV nutrition, but pharmacists get involved in alongside dietitians, or like the gastro feeding, you know, your peg feeding, for example. So that can be quite specialist, and some people do get involved alongside dietitians to like maybe prescribe certain things or give advice on the electrolytes that need to be added, for example, to TPN, which is the total parenteral nutrition. So I think they can be a little bit of confusion. Oh, is that what you're going to do? We're going to have a job coming up that's for this. And I'm like, no, this is completely different. This is a different way of working. But on the whole, it's interesting that the more people I talk to, and so like there were some doctors I think I used to work with as well, and telling them I'm studying this is where I'm heading, as well as pharmacists, they were like, oh, you're so right, we do need to be looking at this, and it's about preventative healthcare, you know, helping people before they even get to those conditions in the first place, the chronic conditions, but also, you know, just helping people who have got the chronic sort of metabolic conditions, for example, you know, helping support them in other ways beyond just medication, because it, you know, especially because they're seeing people coming back in, or they're getting more and more medicines. And as we're aware, you know, we're becoming more aware actually that, you know, medicines can themselves cause nutritional deficiencies as well, which can then exacerbate the situation. So it's interesting actually, since I've been on LinkedIn, for example, I've had quite a few pharmacists sort of, you know, reach out to me who were sort of like, oh, I'm really interested in doing that. Can I have a chat with you about it? Because I think there's more and more people, there's a bit of a movement, I think, happening, and people are becoming a bit more interested in this and going, actually, I think that's the way to go in the future. Yeah.
Oh, that's brilliant. So it sounds like people have largely been supportive and interested in what you're doing.
Yeah.
And I do think there's a bit of a movement, a bit of a shift, people understanding how much lifestyle impacts our health.
Definitely.
Yeah, definitely. So on that same note, how important do you think food is in health? So there may be people out there who would say, you know, medicine is so much more powerful than food. You know, why would you bother with working with food? I just wonder, what would you say to those people?
Yeah. Food for health is vitally important. I mean, when I did the course, I think it was I was blown away actually, and it was a massive eye opener, because as pharmacists and doctors as well, actually, we don't get much training on nutrition specifically. And it was just amazing that there was no tissue or organ, you know, like, is not touched by nutrition in some way. And our cells really need the nutrients to function optimally. So I think for me, it's about at the cellular level, you know, we need food for health. And I think it's that moving away from, you know, there is obviously a pleasure element with food, which is great, and a social element. And I think that's really important. And actually that's part of our health as well, actually, in that social environment. But the food, for what we're in such a rushed society, and as you're aware about the processed foods and things that taste really nice, and we know that it's that the fat combined with the sugary and the salt and the tasty goods, and the food manufacturers know how to hit that the dopamine hit in our brains. I think we've become so numbed and I think dull to what our bodies are trying to tell us. Because symptoms, that they're there for a reason. It's body's sort of way of saying something's not right here, something's out of kilter. But I think what we tend to do with food is it's just one of these things that it just needs to be done, and we need to eat for fuel. And it becomes a bit more about calories rather than nutrients, and which is what we're seeing a bit more of, actually, that people are overfed, maybe overweight, but they're malnourished actually. So people are coming in and seemingly looking like they should be healthy, but actually when you scratch the surfaces, there are nutrient deficiencies going on. So I think that's where food needs to come into health. The thing about medicines, yes, they are potent, and actually I think for me sometimes a bit maybe too potent. Like I think we tend to basically, I was just thinking about examples the other day about, you know, where the way we were taught it in this nutrition course, it's about the naturopathic approach sort of says, you know, with medicines, what we tend to try and do is we're sort of suppressing symptoms. So like, for example, if somebody's got, you know, gastritis or reflux, we will then go, well, we need to dampen, reduce the acid with a proton pump inhibitor. But the stomach needs acid for us to digest optimally, and if we're not digesting optimally, then we're not going to get the nutrients out of the food. So when we're dampening something down over here, it will have a consequence elsewhere. And I think we are beginning to see that with some of the studies that have come out in the longer term research for like proton pump inhibitors, that there is hypomagnesemia. So we're getting low magnesium levels. You're getting all elderly people who are coming in with low sodium, which was quite common that we'd see in like a medical assessment unit, for example. So yeah, I think it's that whole thing of, for me, I'm sort of seeing things. Sometimes medicines can be a little bit of like a plaster on a massive wound underneath going on, and it's your body's going, no, now that you've shut this down, this is going to happen over here, and it's a bit like whack-a-mole. It's popping up somewhere else. But I mean, having said that, there is a place for some medicines. Obviously, insulin is like life-saving if your pancreas isn't working properly, and you need antibiotics when you're having a raging infection to really get on top of that. So we would try, and as nutritional therapists, obviously work alongside medical professionals, and that's or other healthcare professionals in general as well. So.
That's great. Yeah, thank you. And so I think you've kind of hit on this, but I was going to ask, what do you think of the idea that food is medicine, food as medicine?
Yeah. So I was actually, when I was reflecting on this, I was thinking about food as medicine. And actually, when you the way we talk about it, it's almost like food needs to be used to fix something that's gone wrong, because medicine is seen as that, isn't it? You give medicine when somebody's unwell. But actually, I think for me, it's more than that. It's more than just medicine. It's again, going back to the cellular level, it's providing your body to work optimally and firing on all cylinders, whatever season or state you're in life, because that can shift and change. Chinese medicine talks about that as well. We talk about from a naturopathic perspective, like in your younger years, you're in more of a damp state, for example. That's why you're sort of like dribbling and all this sort of thing, whereas when you're elderly, you're in a more dry state. So I think things change as we shift and change through our seasons in life as well. And I think food can be used for preventative, like to prevent health conditions from occurring in the first place, and to sort of live optimally and like allow your body to work as well as it can, with the right support. And that might then mean putting food in, but it also might mean taking certain foods out because you become less tolerant, for example, if we've got a food allergy or an intolerance or for some reason, or our genetics, or it could be that we've changed which country we live in, and then we sort of respond differently to the foods that are there or how they're grown, for example. And I think that's the other thing. I think we're sort of seeing a changing landscape in the farming world. How it's food farmed. There's nutrient deficiencies because the soil's being depleted, for example, of the use of pesticides, and then you've got genetically modified things. So I think we're sort of battling alongside this changing landscape as well of what's going on with food in general. How is it produced? How is it manufactured? How is it packaged? With the plastics and all that sort of thing. So there is so much beyond that, but linked into that. So food, I do like the term food as medicine, but I think it's more than that, I think, isn't it?
That's brilliant. What a great answer. Yeah, that's lovely. And would you say you use your training as a pharmacist in your work as a nutritional therapist? Does it come into your work now? That sort of patient contact, the clinical aspect of working like I did in the hospital setting. You still, when you were working in a hospital, you had to look at bigger picture as well in terms of so in some ways it was an individualistic approach, looking at the patients and what's their weight or their height or their age, because certain medicines were dependent on that, depending on which dose you give them, for example, what's going on with their kidney function. So we look at blood test results. So with that investigative sort of look at things was there, and I'd worked as a medicines information pharmacist previously as well, so that was using resources and having those skills to know where to look. If somebody's on a certain medication and they say, can I take this herb, for example, or can I take this supplement, you can then see if would be any interactions. Is it safe for them to have that? So I've worked in medicine safety and pharmacy as well, so I come with a very safety lens even as a nutritionist, actually. But I think there are things, and then obviously in a hospital setting, you are working alongside other healthcare professionals as well. So I'm so used to sort of saying, right, I'll stay in my lane here, but I'm happy to sort of refer or get advice from other folk, or making sure that what's right for the patient is important. And where it differs maybe is, I think in the NHS we are very much, and this is why I was like, there may be some gaps and people are falling through those gaps. Sometimes there is a tendency to work in silos, and I think that's just the way, there's specialists for this, and then the GP's like in the middle trying to pull all the strings together. But it can be very protocol and guideline driven. There is a tendency to do that maybe in the nutritional world as well, but the sort of the foundation of nutritional therapy is more looking at people on a one-to-one, holistic, individualized approach. So one size doesn't fit all at all, because their genetic makeup could be very different to a client you might have worked with very similar symptoms. It could be the ethnic origin is slightly different, so they handle things differently, or their foods that they're exposed to in their culture is different as well.
Or it could be their gut microbiome, makeup is different as well, and that's why they're intolerant to certain things. And their history, so what I was fascinated by, the whole holistic approach, I was like, I never thought about, if somebody had a cesarean section, have they been breastfed or bottle fed, and how that changes the landscape of their microbiome from the get-go, how that then manifests in different ways as they get older. So you might see more autoimmune conditions appearing in people who might have been a cesarean section baby that's not been breastfed because they've not had that immune support from a young age, for example. I think it's broader than working as a pharmacist was. But yeah, there are some sort of skill sets that, sort of span both.
Yeah. Amazing. Yeah. And in my experience, there can sometimes be skepticism about nutritional supplements, taking vitamins. I've heard people refer to people who take those things as having very expensive urine, as if, you're basically just throwing your money away. Yeah. And I wonder what you would say to that kind of a view.
So supplements is an interesting one. I think, you can... Yeah, I've heard that sort of thing before. It's like, I'm peeing my supplements out because there's like a bright orange colour, and it usually is when you've had some B vitamins or and because obviously water soluble vitamins like your B vitamins and your vitamin C, your body just holds on to what it needs and then it will just flush out the rest because it is water soluble. So in effect, there may be some truth in the fact that you're sort of peeing some of that out. But yeah, I think although that is the case, there are some situations where you might need supplements, and then going back to supplements that actually might be a waste of time and money. Not all supplements are sort of equal, and it depends on the type of supplement in a product. And an example would be something like magnesium. So studies show that magnesium oxide is not very well absorbed at all in the body, whereas something like magnesium citrate or glycinate, your body recognises it better because it's sort of bound to something that it's more of an organic salt that it's bound to, rather than the oxide, which is a bit more inorganic, and your body doesn't quite recognise it in the same way. So sometimes I look at some of the supplements that clients might be taking and I'm like, I'm not sure that's going to be having the maximum effect. Let's try and switch you to something that might help if I feel it's beneficial for them to carry on with it. And obviously some supplements have got fillers in it, that might not be good, or artificial sweeteners that we try and avoid because of the effect on the gut microbiome. But yes, so there are situations. I mean, I've had clients come to me where they're on a whole host of different supplements, and they've just gone, I was listening to this podcast, so I thought they said that would be really helpful when I've got this condition, and then I've added this on. And there was one client I had who was, when he added it all up, I was like, oh my gosh, you're taking quite a lot of zinc, more than like 50 milligrams a day, which is like your upper tolerable limit, really. If you have too much zinc, it can knock your copper off as well, because the copper sort of zinc ratio is quite important, and if you have it, you can end up with long-term copper deficiency as well. So we sort of rationalized all of that and clawed that back, and I said, right, from a safety perspective, so there can be a little bit of a danger in in sort of jumping on the next hype and going, I'll try that. But I mean, you can see why I think people are not desperate, but they're sort of wanting answers. They're trying to fix things for themselves. But I think that's where I think it's important to get somebody to come alongside you who knows what they're sort of talking about, what they're doing and what you actually need. And it might be that you don't need those things because you're getting it through your food, or it could be that actually you're needing this because of the diet you're following. So like, for example, vegans, we know that they may need more calcium, or vitamin B12 in particular is one thing that they are recommended to take. So it depends on the diet you're following. But also, if you've got any malabsorption states in your body, you might not be absorbing very well. For example, if you are in a PPI or you're on the oral contraceptive pill, and that's known to cause folate or vitamin B deficiencies. Metformin has been known, the MHRA talk about, the vitamin B12, look out for deficiencies in people who are on metformin. So yeah, it depends on what medicines you're on as well. So there is a lot to sort of consider and take in, and obviously then be careful as well of any interactions with any of the drugs that they're taking.
Right.
But I think my first protocol, and this is, what nutritionists will talk about, is, use food first wherever possible. But we are mindful, as I've spoken before, about the over-farmed soils, that you might not be getting enough magnesium. Actually, a lot of us are deficient. And I remember listening to a webinar recently about how a lot of people are probably selenium deficient because of the soils are quite depleting that as well, and the impact that can have on thyroid function or your hair, how your hair grows. Always lots of hair loss is happening, for example. So yeah, it's the trace minerals I think we need to be sometimes mindful of. But yeah, so it's interesting.
It's interesting.
Yeah.
So it's a much more complicated picture than just going and buying a supermarket multivitamin and, calling it a day.
Yeah. And I think the quality of supplements can vary. And I was just, thinking one in particular is things like fish oils. People buy fish oils that are quite cheap, but they may not be of good quality, and they can turn rancid quite, if they're not manufactured in the right way, or, if they're taken from larger fish, for example, you've got, is the company actually looking at how many heavy metals are in there? Yeah. So it's that sort of thing about the quality. And then things like your fat soluble vitamins, they're better absorbed if they're in an oil or some sort of fat, for example, vitamin D or vitamin E, and how is it manufactured? Yeah.
Right. Oh, that's very, very interesting. And so in your work as a nutritional therapist, is there a typical type of client that you see?
So it can vary depending on, I know some nutritional therapists have a niche of some sort. So some people do sort of think, I'm going to work with autoimmune condition clients, or midlife women who are trying to lose weight, or dealing with menopause, for example. Whereas for me, I think because I've come from the NHS background, or the pharmacist sort of background as well, I think I have a real heart for helping folk who have, got chronic health conditions that they've tried medication, for example. They've sort of been passed from pillar to post a bit in the NHS, got a bit lost in the system, and feel quite frustrated because the condition is still not getting any better, or maybe getting worse. Or maybe want to try natural ways and maybe not rely so heavily on medication. So it's those sorts of clients that I'd like to help. But I think what I'm seeing a lot of clients coming in with is mainly sort of your gut health issues. Tends to be to do with, like, maybe it's IBS, or they've just got ongoing gastritis or constipation, for example, and just bloated. Like, a lot of people feel quite bloated and feel quite sluggish. And then alongside that is things like low energy levels, and just lack of sleep, and just feeling like they're running on empty can happen as well. I mean, there are some clients who've got other health conditions that are sometimes tied into some of the main symptoms. And what I find quite fascinating is that, when you start to tackle some of these things, some of the other symptoms start to disappear. So like, it might be that you're dealing with the gut, but the skin starts to clear up, and they're like, I've had acne for years, and that seems to be getting better. So because everything's so linked, once you start to sort of get to the root of things, you realise that your body's been giving you some signs and symptoms, the body whispers, as we call them. There's always something that it's telling you. And I think the other fascinating thing I've not tackled before or spoken about before is the whole thing about the oral health. And I think that's coming up more and more. That
the oral microbiome.
And how actually your oral health can have a massive impact on your body and your gut and your immune system as well. So that's another area. So I'm trying to be a bit more mindful about asking about, what's going on with your oral health. And they might think, that's not, how is that relevant to my, me feeling stressed, or I've got anxiety, for example. But actually it can sometimes give us some clues as well.
It's all interrelated. Yeah, that's great. So can you give us an idea of what kinds of conditions you have either resolved or helped people manage?
So recently I had a client who was they were actually like a fitness instructor, and they were just felt like they were running on empty, but had like ongoing gastrointestinal issues, just not going to the loo, very frequently, for example, and just felt, just very run down, and had just ongoing symptoms that were like a sore tummy as well. And And, we sort of did quite a bit of work on looking at, through a stool test and the gut microbiome, it showed quite an interesting picture. We looked at food intolerances and just helped to support the gut and help the gut sort of heal, the lining of the gut. And we saw really major changes in this person, and she was sleeping better. She was getting loads more energy as well. And she just said, I've just got my mojo back and just feel so much better, considering how she was feeling when she first came to me. And I think having those functional tests really, you can gauge and get a bit of an idea as to what might be going on with somebody. But sometimes when you do those tests, it's sort of like a magnifying glass that makes everything a lot clearer, and you've then got a roadmap to know, right, this is what's going on, because you could guess, and trial and error sometimes does work, but you get results so much quicker, and the clients can actually, when she saw a food intolerance test results, she was like, oh, that makes sense now. I've been going towards the things that are actually causing me, the issues to get worse. And I was thinking, we're making them better. But the interesting thing was, it was when you looked at her diet diary, you'd go, wow, you're doing quite well, because she was getting loads of fruit and veg in. Yeah. But some of it was quite raw. And I was thinking, actually, what we need to do is have warming foods, to nourish your body and the digestive system, because sometimes cold foods can be quite difficult on your digestive system. And they talk in Chinese medicine about digestive fire and the fact that we need to keep it warm, and for example. Yeah. And then another case that I've worked with, somebody who had endometriosis and was feeling quite bloated as well, and wanted to conceive in the future. And we worked on her, gut microbiome, supported her immune system, looked at oral health, actually, because there was something that came up in a stool test that actually made me think, oh, actually that's linked to oral health as well, which was quite an interesting thing. So a referral to a dentist helped with that. But yeah, so later on they felt so much better. The periods were getting, less painful. And later on they did conceive as well. So that was quite a nice thing to, so
that's a really rewarding one.
It is very rewarding, yeah. But I think generally tends to be more, gastrointestinal issues or low energy, maybe some anxiety and stress related things.
Brilliant. And so thinking about pharmacists and the kind of lifestyle that a lot of pharmacists lead, it can be high paced, it can be stressful. What kinds of nutritional challenges do you think there are any common ones that pharmacists are dealing with?
I think the biggest one, I know for myself, and we used to joke about it even with the doctors and the nurses actually on wards, is hydration is a massive thing. Think about how busy, especially in a hospital setting, you're sort of bouncing around from the ward to the dispensary to, just between wards, you're getting paged, can you come over here? And it's like, actually, you need to be drinking water as you go throughout the day. And I think sometimes we're running on empty, and if we're not careful, can get quite dehydrated, which then impacts on your, people are getting headaches, or they're feeling a bit low energy as well. I mean, we're roughly 70% water, our brain 75%. So we really do need to be remaining hydrated. I used to carry a bottle around with me everywhere I went, sort of thing, to make sure I was getting that the water as I went along. And then, you get folk who are, going, in their break, it's like, I'll just go to Costa or something, get caffeine, and then they're getting sugar hits, like, let's add a bit of syrup because I've not had much time for breakfast. Or, people are eating at their desk a lot as well. That's the other thing I noticed. And I know I've been guilty of that myself at times, because just of rushing around, or you might have a lunch and learn and it's a webinar, so you just sit and eat at your desk again. And the whole thing of like eating on the run, maybe not having much variety in your lunches. Some people can get quite stuck in having the same, just because we're so busy. It's like, I just have the same sort of sandwich every day or something, or I'll just buy something from the shop at the hospital. Or in your community pharmacy, it's like, I'll just grab something, and which is like processed really. And what we want to try and do is get some more nourishment and have more whole foods. And, so I think snacks as well. Again, it's more tricky when you're on the go to sort of be like, I've got my fruit at my desk. But when you're sort of mobile and you're in between, you're not really meant to eat on the ward and all that sort of thing. So your work environments can sometimes work a little bit against you if you're not careful.
Yeah.
And that can then lead to nutritional deficiencies. And I think we are probably all needing more magnesium in our lives, I think, which is quite calming and it's quite good. But obviously, if you're quite stressed, our adrenals are quite hungry when we're stressed. So they do go through quite a lot of magnesium and vitamin C, for example. So we are quite in a stressed environment, and that can then lead to these deficiencies further. And obviously we know that with vitamin C we need that for our immune system as well. So when you're around more people with bugs and stuff, you're more likely to sort of get run down and maybe catch more things as well.
Okay, so magnesium and vitamin C would be a good tip. Are there any other ones that you think are generally probably good for most people that we should all be thinking of?
I think vitamin D is another one. I think that's massive in this country.
Sure.
And even when I've done talks to workplace organisations, you sort of talk to me, has anybody taken a maintenance dose? And nobody really is. And a lot of them have got sedentary jobs that are indoors. A lot of the time they're not getting enough sunlight. And sometimes ask the question, when did you last get your vitamin D level checked? And a lot of people don't really know. And I think I've had a couple of people come up to me after talks or they've said, actually, my boyfriend had theirs checked and it was really rock bottom, and that's why they were feeling really low mood and stuff. And actually it made a massive difference when they started getting their levels back up into optimal range. Yeah. So vitamin D is another one, but testing's really important for that, I think. And there's been more research come out that vitamin D combined with vitamin K2 is very important combination. Like the vitamin K2 helps direct the vitamin D and the calcium into the right places. It helps with the absorption, make sure the calcium's not furring up your arteries, it's being directed into your bones instead. So that combination would be a good
vitamin
D
and
thing.
K2 for bone health.
And then you've got your omega-6 and omega-3 ratios, and making sure that you're not getting too much of the omega-6, which is through your processed oils. Making sure we are getting more omega-3, which is your things like your walnuts, your chia seeds, your oily fish, because in the Western diet we are very heavily omega-6 rich, really, a bit too much. We do need both, because I think sometimes things can get a bit demonized, well, that's bad and that's good, but actually we do need a bit both, but the ratio's got to be right. And I think we're getting too much of the omega-6, which can cause inflammation.
Okay, that's great. And in terms of food, I know that there can be massive differences because people have different intolerances and different dietary needs. But in terms of foods, are there any that you think are generally quite good for most people and that we should all be trying to incorporate in our diets?
Yeah. So I think whole foods, going, that whole thing about if your granny doesn't recognize it, don't eat it, sort of thing, try and eat things that in the most natural state as possible, as close to, like your fruit and veg, some people do better with things like chickpeas and legumes. Some people may not do so well on those, depending on their genetic makeup as well. But making sure you're getting your fruit and veg, because that ideally the ratio is you want more of the veg, so 7 a day, to maximum of the fruit, and that's because you want to be, it ticks so many boxes. So obviously we talk about the rainbow color of different fruit and veg because they've all got different antioxidants and nutrients. So making sure there's variety is key, that we're not sort of going back to the same sort of fruit and veg we have all the time, but trying to mix it up a little bit. They say about 30 different ones, your plant-based things a week is really good. And then it's the whole thing of even how you cook them. Don't overcook them, because then you're sort of depleting the nutrients in them. So fruit and veg, it ticks the boxes of fiber. You've got your antioxidants in there, which really help reduce your inflammation in the body as well. And they talk about it being alkalinizing, so our bodies do better when it's in an alkalinized state rather than very acidic, when you've got loads of red meat and things that are beginning because you sort of hold on to things that you don't need, like cancers love this more of an acidic environment, for example, but it feeds the gut microbiome. They need the fiber to be fed. So you're doing that, and then obviously to reduce constipation and all those things as well. And then things like, for me, protein is quite important, especially at breakfast. I think it's a really good way to start the day. I think again, the standard Western breakfast tends to be quite carb heavy. It's very sugary. Think about, you've got your orange juice and you've got your toast and you've got marmalade or cereals that may be sugar laden as well. And then if you add fruit to it, that's another bit of sugar, but at least it's better than not having it. So I think what happens is if you do that, you just got this, like, you're on this blood sugar roller coaster for the rest of the day. So having a protein rich food in the morning, like things like a couple of poached eggs on some sourdough, whole meat, like a sourdough toast or something like that, with some avocado, with your healthy fats as well. So you're getting a bit of the carb, a bit of protein, a bit of healthy fat to try and keep you more sustained. And then you're less likely, I think, to reach for those sugary hits and snacks. And that's another thing with pharmacy. We were surrounded, and the tea room was surrounded by like biscuit snacks, or it's somebody's birthday, so they bought a whole load of donuts in, and it's like there's all these temptations around you, and on the wards, patients, bringing chocolates in for people.
Work cake, they call it everywhere.
That's another thing. It's like being mindful of having healthy snacks to hand. So like, whether you can have some nuts in a tub that you can just reach for, even if you really need a bit of sweet, have some dark chocolate, with it as well. So you've got some of that. It just satisfies the sweet tooth a little bit, and that chocolate hit as well. So those are the sorts of things, and you can incorporate more fruit, like fruit and veg as well. So you like cut up apple with some nut butter, or some celery sticks or carrot sticks with some hummus, or some guacamole, which is a really good combination as well. So it's those sorts of things. But the other thing, I think, with nutrition, we talk about the food side of things, but I think we need to also be mindful from the lifestyle perspective. Is like the whole thing about mindful eating is really important. Because you could be eating the right foods, but if you're wolfing it down and you're not chewing your food well, you're not going to be absorbing the nutrients as well. Because it sort of, it just sort of it goes through. In Chinese medicine, they talk about your stomach doesn't have teeth, which is why we sort of meant to sort of break down, especially proteins are very much better absorbed if you sort of chew your food well, especially meats and fish and your proteins. So to try and chew well, but being mindful of it and not in a rushed state, because you're more like, your brain doesn't sort of register that you've eaten. And if you're eating in a rush, that's why people end up feeling quite bloated and get acid reflux and all those things as well.
Interesting.
So it's that rest and digest. So you want to get into the parasympathetic nervous system, and then your body's more likely to absorb and do better with the food that you're eating as well. So I think for me, nutrition, which is why I've called myself nutrition and lifestyle pharmacist, because I was like, actually, you can't divorce the two. Nutrition, great nutrition's great, but I think if you don't tackle the lifestyle side of it, and vice versa, then you could be carrying on being stressed, and you're just going to be continually depleted. Like your adrenals are going to keep being quite hungry for magnesium or vitamin C, for example. Whereas you do need to try and address that stress to try and reduce the inflammation in the body alongside a diet that helps with that as well. But both, I think, go hand in hand quite well.
Okay, that's great, Jazz. Thank you so much. And I think that's a really good place to end our podcast today, because you've given us some really good tips that I think pretty much anyone could take on board. And busy pharmacists, I'm sure, will be really interested to hear what you have to say about things that they can do. I think it's been a really inspiring conversation about how food and nutrition can help us all to create optimal health. So thank you, Jazz, for sharing your insights and for being a part of our Pharmacist Support podcast.
Thank you, Melissa. Thanks. It's appreciated.
We hope our listeners are feeling inspired to bring about positive changes in their own lives. So if today's podcast has resonated with you, you'll find further well-being information, videos, and online content on our website and on our Wellbeing Learning Platform, which is available to pharmacists, pharmacy students, and trainees for free. You may be interested in our gut feeling, nutrition, and mental well-being workshop, which is on the Wellbeing Learning Platform and can help with understanding how these nutritional changes can impact mental well-being as well as physical. For further information on our support services, please click on the How We Can Help link in the podcast description. And please don't hesitate to reach out if you feel you may need support. We want to continue providing our free and confidential support services to open up conversations like this, to ensure that no one in our pharmacy family faces challenging times alone. As an independent charity, we rely on donations from individuals and organizations across the profession to help us to do this. So if you're in a position to do so, please consider making a donation today. You can find a QR code in the show's description or at the end of the video, and donations help us to provide our essential services, including our counseling and peer support, our financial assistance, and more. So thank you so much for listening. Thank you again, Jazz, and we look forward to seeing you again at our next podcast.